Hello. Hello,
Hello, how are
Lisa.
you?
I'm good. I'm good. Hello, Lisa.
Hello, and
Can hear
hello
me, isn't it?
from,
Yes.
yes, we can hear you, and hello from Denmark. Here is a little bit colder weather than
Oh,
it
yeah.
might be.
Yeah, I'm in Madrid. It's a bit warm here.
Oh, it must
Okay.
be.
Yeah.
So it must be also a lot of celebrations with
Yeah.
football.
Today we have,
Congratulations, Spain.
yeah, thank you. That's another good news that we are having now. So
Yes.
we are, okay. So
So it's good to
let's,
see you, and we were thinking maybe to talk a little bit about the upcoming Ayurveda course that
okay.
will be starting this September in Málaga in Torremolinos, and this time it will be organized in English because we don't have so much professional studies in English in Spain. And there's many people who don't yet speak Spanish. So we wanted to give them also a possibility to study.
Wonderful. Wonderful. That's very nice.
Yeah.
And so I think when we are talking about giving courses of Ayurveda in whatever language, the basic thing that we need to keep in mind is about the quality. Of course, Ayurveda is different from yoga. Yoga means it is a practice. It's for your, just like a practice for your mind, it is a daily habit. But when it comes to Ayurveda, it is a medical system. So you need to learn it from somebody who is qualified. And that is one of the problem we Ayurveda doctors who are from India, who have a qualified degree from the only university degree in the world, which is in which is for Ayurveda, is only given from the University of India. Many of the I come from the University of Kerala, and I have a degree in Ayurveda, and we are the professionally qualified people to teach Ayurveda. And this is the main problem that I have been facing in Europe since the last 15 years. If it is
Yes.
like a cooking class, it is okay. Anybody can teach how to cook. If it is about an exercise, anybody can teach about an exercise. But when it comes to health, and moreover, it is not the classical, it's not the West, what you call allopathic system. So it is something that the West is also not aware. It is similar to Ayurveda, to yoga in that sense, because you don't, most of the information is not available. So in that way, the information has to be original, and it has to come from somebody who has learned Ayurveda in a university. In India, most of the yoga people who learn yoga, also assimilate a bit of information of Ayurveda. It is wonderful. It can be practiced along with yoga for your personal care. But when it is coming to other things that were change, there are variety, just like any other, this is a professional thing, the professional activity. You need to learn it from somebody who has got a valid training from an university. And I think most of the people don't even know that there are university degree qualified Ayurveda practitioners in the world. And we are the people who have the degree called Bachelor in Ayurvedic Medicine and Surgery. It's a 5.5 year course, university course, a professional course. And we learn right from anatomy to all the pathologies and all the specialities of a human medical practice, and we are regulated from by the government of India when we practice in India. So
Mm.
there's a structure. It is not like yoga in that sense. So when this, I teach also in Spanish. I I also would like, and this course is the first time that I'm going to take in English.
Yes.
And still, I would like to insist the requirement about the quality of the Ayurveda education all around the world. This is because I have been in the committee, in the World Health Organization committee, which we had published the benchmarks of how the training has to be done in Ayurveda. And we published it last January, not this one, since more than 1 year. It's now 1.5 years. And so we, most of our programs, even what we are going to do, what we are being taught, what is going to be taught, is based on that format. So,
Yes.
so we are following a standard protocol that is advised by the WHO, and we want to maintain that, or to develop that quality of education, so that anybody who learns will be having the capacity to help to use this knowledge in the right way to
Yes.
help.
We are so grateful to have the education now in Europe also. It is so important. And what so this will be this course that you will be giving here in Malaga. It will be 10 months. So it is
Yeah.
10 weekends. And would you like to tell what is that the participants will learn during these 10 months?
Okay, so it is one weekend every month, Saturday and Sunday, the whole of Saturday and half day of Sunday. We will be learning for 10 months. So during this class, Saturday will be for theory classes, and Sunday will be dedicated to the practical classes. Okay, so during the first 2 weekends, we will be going through introduction, because this needs Ayurveda. When you start to learn, you have to, the basics are different. The parameters which you will be learning will be different from what you normally learn in the university, normal university courses. So that has to be, there's an introduction part. And then we go, the rest of the uh, month, we will be learning about Ayurveda nutrition, and then about Ayurveda massage therapies. We call them treatments actually. Okay, so we will be learning about the technicalities of Ayurveda nutrition. Actually, the technicalities are, we'll be learning about rasa, that is the taste. We'll be learning about gunas, that is the fundamental information with which Ayurveda works. It is understood in the context of food and medicines, and also it is understood, it has to be understood on the context of physical, on manual therapies also. So it is a key lesson which is called guna. Then we learn about the other technical parts of virya, vipaka, and prabhava. Those are the methods with which, those are the components with which we can evaluate any food and drinks and herbs all around the world. So once you learn this knowledge, this method, then you will be always thinking, and from then onwards, you will be able to apply that in your normal day-to-day life, and you will be able to understand what is actually happening in your body and why. So this is that is the basic benefit of this course. Apart from, it's not like you take a herb and then you know this. That is the Western herbal medicine is taught that way. You take one herb, you will be learning about that herb alone. But Ayurveda, you will be learning about a technique where you will be able to understand how all the herbs will be working inside your body. So once
Yeah.
you learn, it's a technique. It's a that is the core science of Ayurveda, and this can be also used for using the massages also. There too, we will be teaching you 4 massages. That is, well, not Abhyanga is not the only massage therapy used in Ayurveda. Any massage using oil is Abhyanga.
Mm.
So that too, it has to be applied under certain protocols. Only then can anybody get a good result. So you will be
Yeah.
learning about those minute details in this course. So it's not like you take some oil and put on the body and you massage from left to right. That is not how it works. It works on how, because now is that when you will be understanding what is the functional activity of the gunas that we have learned earlier. So
Yeah.
when we apply the massage, we will be understanding how the body is reacting. During the massage, you will be knowing whether it was a right massage for the person who is receiving it. You'll be understanding it from the reaction, how when the oil is applied on the body. So all these minute details can only be learned from a qualified person,
Yes.
and you will be
And
able
what?
to. So, yeah, because I'm really enthusiastic to teach people about this, because it is highly connected with how we function. And
Mm.
I
And it is,
I have, tell me.
yeah, it is so interesting that maybe some people think that it is so simple that we just learn some techniques, but it's not, because we need a lot of theory before we understand how different, unique people work, because not everybody is the same, as you said in allopathic medicine.
Exactly. Ayurveda, the basic central idea about Ayurveda is a personalized medicine. So the aim is to, and the original concept of Ayurveda is that each of us are different. And the medicine, the application of each therapy of the, even if it is a food, even if it is a combination of herbs, even if it is a massage, it has to be adapted perfectly to your situation. So that there is a technique used in Ayurveda, and that is what you will be learning. And
Yes.
I would like to also tell you, we won't be learning the whole Ayurveda medical treatments in during the 10 months. We'll be learning part by part. We'll be learning the relevant part with which you can start practicing. You
Mm.
can be giving a massage to somebody for something that is useful to them without causing any damage. You will be
Yes.
becoming professionally what you call equipped, understanding that what are the limitations, when you should not be giving the massage, and what are the things that you can really apply the massages, where and when. So it is not like you get. So we give a professional training so that you will be able to apply this technique in the right way without causing damage to anybody, and the all that you will be applying will be benefiting somebody.
Yeah.
That is the whole idea.
And
So
we also learn some nutrition
yeah,
and
that is also
yes.
because whenever we are talking about massage therapy, it is actually goes, it has to be understood based on the situation of the digestion of the person, and then maybe in many occasions you will have to advise some nutritional advices also. Otherwise, just learning massage is like getting only, it's like like buying things from IKEA without the manual.
Mm. Yes, so it's very, very big concept. There's so many things to learn, and it is years and years of practice, but you have to start, of course, somewhere.
No,
And
it is no.
yeah.
What I am enthusiastic is that I have been in Spain since last 15 years, and I've been teaching since the last 15 years. So what happens is, I know with my experience, I know the mistakes that a Western person, a person from West, when they start to learn Ayurveda, what are the mistakes they normally make?
Mm.
For example, when they learn about doshas, I have to make them unlearn that dosha does not only mean constitution. It is like, because people are enthusiastic about a different knowledge, and mostly the knowledge is so useful, and it is very like, when you are classifying with vada, it seems so perfect, but I have to make them unlearn just to about the mistakes that they, when they learn about vada, they just apply it to understand the constitution alone, and then everything will be understood only on the basis of that,
Mm.
and then they won't advance. So these are things, there are things that as a teacher in Ayurveda, where I will have to help them to unlearn and learn the right perspective. This is mostly because it happens because there are errors that are being taught earlier by people who had translated
Mm.
Ayurveda from Sanskrit to English, and they have made many errors, and there are nobody who has corrected it, and people who have learned these errors make them. So we have to make them unlearn that. So our, the basic idea is to make people understand the right Ayurveda, to apply it for people, so that somebody can get healed or somebody can get benefited.
Yeah. And who could be, for example, whoever can come to this course, or
Yeah,
is it that it is beneficial for therapists, or what do you think?
I would highly recommend any massage therapist, any therapist who is working in alternate medicine, to start with this course, because this is a complete course which has introduction, which has the part of nutrition advices, which has the part of the manual therapy. So this course, it will be very, and moreover there is a practical, practical, every month you will be learning under my supervision.
Yes.
So the thing is that you will be learning how to follow, do this treatments and make this nutrition advices in the right way. And this is a wonderful course, and you, it is spaced in 10 months, so that you get the time to assimilate it when you go back home. In the other 3 weeks that you are at your work, you can practice it, and then you can learn and come with the doubts, and will get, there is no other course offered in Spain where an Ayurvedic doctor is there throughout the year, teaching personally these Ayurveda massages and nourishment. Is because I live here, but most of the people who teach Ayurveda come here for just for a visit, or they don't
Yes.
live here.
Yes. And this is also possible. You are very flexible if somebody can't come all 10 weekends, if they live abroad, for example. it is partially possible to do also online.
Definitely, because all the modules, all the video recordings will be available in the website. So there will be a login to our website where you will be given the access to all the modules, and you can, if you are unable to come and be there present, then if you are unable, then you can log into the website and hear and learn the course through the video classes.
Yes. And of course, we recommend that the few of the practical parts, it is good that you can see how these
Elisa,
treatments are practiced.
yeah, Elisa, because there is massages involved, this will not be 100% online course.
Yes.
So, because even though you may be what you call a good massage therapist, but until and unless you are supervised by an Ayurvedic doctor, that you are doing the Ayurveda massage therapist in the right way, you won't be able to, we will not be able to certify you that you are qualified to do these massages for other people. So there is a minimum requirement, not, well, there are people who will be far away, who are coming from outside the country, and maybe they may not be able to attend all the classes, but I would insist them to be at least present for one of each of the massage. We core massages within the course. So I would highly recommend them to be there at least for one of each of the sessions.
Yes.
And at least one or two, and then once I understand once you get the idea about what we are talking, then maybe you can stay away, maybe you can do a video recording of your practicals, and then I can evaluate you. But those are flexible things because we want to share our technique with you. So we are highly flexible, but there's a basic requirement that we would want you to be. We want to confirm that you have understood the technique. That is all.
Yes, here we come again the safety, and it is very important. Again, the quality of the supervision, and then quality of when you start doing the massage and therapies to other people. And we did also choose the place where is the course. It is really beautiful Kalma Yoga Studio. It is just about 15 minutes from Malaga Airport. So anyone who comes with airplane to Malaga, it is very, very easy access. So that's why it's also easy with car if somebody comes close by. There's parking, and we have enough space to do all the practice with massages and then the classes. So it is really nice environment. Also, there's a little park next by, so we can be close to nature and just relax a little bit in between the classes.
Yes, I think that is wonderful, because anyway, when we are coming, if you are a student who is coming from outside Spain, maybe that will be really wonderful. When you are there, you will be having some interactions with in the free time.
Yes, of course. Yes. Is there anything else you would like to tell about the course, or
Definitely.
Yes.
First of all, Ayurveda, what we are trying globally is to make sure that people are understanding this science so that you can apply into your daily life. So I have been teaching for 15 years. The method of teaching Ayurveda basically was always classical method. That is, you will be so in this course we will be using a adapted way. All the information is originally taken from the Sanskrit texts and then translated by myself and then explained, because we learn these verses, Sanskrit verses, in our university. So there are information that are hidden inside the verses. So if it is a normal translator, who is a professional translator even, he will miss some of the hidden meanings which only a Ayurvedic doctor can understand. So this type of translation has never come out in the West.
Mm. And
Well,
I would also like to remind that there's many Sanskrit words, so there's no reason to be scared about the terms. You will explain everything. Yes.
exactly,
Mm.
because there are lot of flaws in which are been happening in the teaching field of Ayurveda, where most of the teachers were insisting about the words, Sanskrit words, for a person coming from a different language. He will not be able to maybe at least even pronounce the word. So any word has a translation, and the problem with Sanskrit is most of the translations even are difficult because English may not have enough words for it to be translated in the right way. But because I have been teaching since so many years, I have understood what is the problem, what's the practical problem here in the West.
Yes.
So I have good experience in correcting them, in communicating. The words are important, but not on the first day. You will be learning it gradually, understanding the terms, what they mean, and once you understand it, the whatever the terms will be very familiar for you. It will not be foreign to you. You will be using the terms in the right way.
Yes.
So I don't think there is any reason for anybody to be anxious
Mm.
based on the
Yeah.
uh, Sanskrit words, because it will be totally translated for your understanding,
And
and that is how it is.
I've been on your classes and you explain everything very clearly and it is easy to ask questions and there's enough time so that everybody understands. So there's no reason to think that this is too difficult or something. It is also very practical.
Actually, it is very simple.
Hmm.
It is very simple, and Ayurveda, when it is understood in the right way, it is just common sense. You will be
Yeah.
understanding that. You will be able to connect many things together, and the aim of the course is to teach this technique to you. So
Yes. And I also had a question, somebody wanted to ask that they are not maybe wanting to do the therapies, but just to join the class to adjust these techniques to their lives, and that is also totally fine if it's
this
only
was
for
another
your
point.
own. Yes.
It was another point which I would like, which I first of all, any person who is working in the alternate medical system can use this. Even it can be used by Western medical doctors to understand more about the alternate system. Apart from that, a normal person who is only interested to use something that is good for their personal health care, you can also join, because this course has the introductory part, and then we learn about the basics of the nutrition, and then we learn about the basics of the manual therapies. So this is not, this is always, this is advice for even beginners. And there is no, this is not a specialized course. It is advised for, so for a person who is like to take some information for personal use, self-care, also can use this.
Yes. Yes, I remember when I started to study Ayurveda, it was very useful to everyday life, and then you slowly start to see everything what you eat and everything what you do very differently. It is very practical and, as you said, common sense.
It is, it can be understood like that. Mostly you will be getting some knowledge about this nature, how this world works, how our body works, how our body resonates with the environment. You will understand why people get sick when it is going to rain. A lot of things you will understand, and you will be getting a better understanding of how to take care of yourself.
Yes. So, if there's any questions about the course, we are very happy to answer them. You're very welcome to send messages, and we will answer to all the
The,
questions. But
one more thing,
yes,
the course, the course is in 10 modules, as we told you, 10 months. There will be a multiple choice question, 10 question exam at the end of each module to evaluate how much you have understood what we have taught you. And the certification is governed by the Association of Ayurveda Doctors, Ayurvedic Medical Association of International Ayurveda Medical Association, and it is an association of Ayurveda doctors in Spain and Europe. So we already have a curriculum and we are following that. And this course is also based on that.
yes,
So we don't have a, well, just to make it, we don't have a university. This is not a university degree, because we are working for it to bring it up to the university level, but still we are on the process.
yes. So there will be a lot of information and a lot of learning about Ayurveda. 10 months, it's quite a journey to start learning about Ayurveda.
Definitely, I think it needs 10 months so that you will be able to assimilate the information. You'll be
Yes,
able to, because it is enough and more information. So it will need 10 months for you to understand it in the right way.
yeah. And it is, of course, then possibility. If somebody wants to continue, then it is possible to continue with you, of course. But this is the start when you have the basic information about Ayurveda and the therapies. Yes.
Yes, there's a small lag. Yes.
Mm. Yes. So, is there something else you would like to add, or then we just answer all the questions that might be, and we start in September then in Malaga?
Oh, that we start in September and it will be going through 10 months.
Yes. Yes. One weekend in every month. So there's also, it is nice that there's a little bit time in between. You can continue your everyday life, and there's time to practice in between the classes. Yeah.
Definitely.
Yes. And we will leave the record here in Instagram, and I will also upload it in YouTube. So then we have a recording here for everyone who would like to see it if you couldn't join right now. So then I will share it in the profile.
Wonderful. That's nice.
Yes. Thank you
So they can
so
call
much for
you.
your time.
You're welcome, Elisa. It's a
Yeah,
great effort, and I congratulate you for
yeah,
this effort. Looking
yeah.
forward for the
Yes,
course.
we will meet in September, the latest then.
Thank you for your time. Take care.
Okay,
Bye.
thank you.
And
Bye
enjoy
bye.
the invite.